Hey guys, welcome back to my channel. If you don't know me, hi, my name is Sarah. I'm a family nurse practitioner and I work at an urgent care. So I just had an interesting encounter with a patient and it really made me think about the topic of safety, especially for female providers who find themselves in an exam room similar to this one, alone with a patient. So safety is something that I do think about a lot at work, probably because I'm a true crime fanatic. And so I'm always thinking about how I would defend myself in certain situations. Definitely one to play out different scenarios in my mind of how I can escape a potentially threatening situation. So I figured, let me share some of my safety tips with you guys and some of the things that I do just to make myself feel more comfortable at work when I'm alone with a patient that's making me feel kind of leery, a little weird, and giving me some strange vibes in an exam room. So the most important thing to me is placement. There's certain areas of the room that I pretty much never go to, and that is in the back corners of the room. So this area back there, I never sit in that chair, in that area in the corner there. I always want to be sure that I am close to the exit. So when I'm talking to a patient, I'll typically have them sitting here, or I'll even have them sit in that chair over there, especially if they're elderly and they can't get up on the exam table here. And I'll stand here. So I'll be standing here and talking with the patient, but also I'm aware that the exit is right here. If anything were to go down, I can quickly just slip right out the room. Something else that's really important is not turning your back on the patient. So especially for male patients, sorry guys, but I never am turning my back to a patient. I know that someone can sneak up behind me and, or, do something. So I try to always face the patient. And if I need to get something out of drawer, I'm still facing the patient, but reaching here, getting the supplies that I need, or I'll just make sure I come to the room prepared with what I already need. But I never really like turning my back to patients, especially if they're giving me kind of weird vibes or making me feel a little bit uneasy. So that's another really important tip. Something else that I do on occasion when I'm starting to feel a little bit uncomfortable, or if a patient's getting extra flirty, or if they're, shaking, really sweaty, feeling nervous, and just making me feel uncomfortable, and that is I will simply crack the door. Or sometimes I'll just leave it wide open. I'll tell them, oh, I'll be back in just a moment. I'll step out, I'll talk to one of my coworkers, and I'll tell them, hey, just keep an ear out. I'm going to keep the door open. Just sit close by just in case I need you, or just in case you need to do something like call the police, which thank God that's never happened before, but just in case. So I'll alert a coworker and I'll keep the door wide open and then just complete my exam with full transparency. Something else that I want you guys to remember is you can always bring a coworker into the room with you. Don't think that, you have to be in here alone. It's totally appropriate if you're in an uncomfortable situation to bring your coworker into the room with you. And if you don't want the patient to be alerted that you feel uncomfortable or that they're making you feel nervous, you can say something like, oh, this person is just observing me, they're in training. You can just come up with something like that just to make the patient feel more at ease and, not get angry or irate or accusatory. Something else that I want to remind you guys of is you do not have to complete an exam or an evaluation on a patient that's making you feel uncomfortable. If you're feeling like your safety is in jeopardy, you can just leave. You really don't even have to say a word to the patient. If you don't want to, if you feel that they're going to get really irate, just walk out. Leave, talk to somebody. If you're lucky enough to have security at your job, God bless you. Call security, have the patient escorted out of the clinic. If you have to call the police, do that. But just get yourself to safety first, because at the end of the day, you want to make it home to your family. This job is just a job. Nobody is forcing you to care for patients that are making you feel unsafe. And just remember that at the end of the day, it's nice to be polite. That's the ideal interaction with patients, is a polite and friendly interaction. But at the end of the day, if somebody's being inappropriate with you, all that goes out the window. So, being a female in healthcare, it is not uncommon for us to run into these situations, as you guys know. But the difference between working in a hospital versus a clinic is, in a hospital, I had that extra support. I'm always surrounded by people, security, people who are stronger than me, who I felt like if they could not help defend me, then at least they could alert somebody who could help me, right? But here at a clinic, I'm here typically with one or two other females. We're all very petite women. Ain't much that I'm gonna be able to do to defend myself. I'm gonna try, I'm gonna fight to the death now, but I just don't have that extra layer of security. So it's unfortunate, but it's just the reality. You know, I'm seeing patients off the street, I'm seeing complete strangers. Anybody can really walk into the clinic and pay to be seen by me. So I just am a bit more leery here, and I just try to be more cautious and careful and a lot more observant of the people that I'm entering into this enclosed space with. All right, you guys, so that concludes my video today. If you have any safety tips for me, please leave them in the comments, and I'll see you guys in my next video.